Okay, this is the Maternal Child Exam 2 Concept Guide, Postpartum Care, Physiologic Changes, What is Expected, Bubble He, Breasts, Primary engorgement occurs 3rd to 4th day postpartum. Breasts are fuller, larger, firmer, often accompanied by redness, heat, and tenderness. Prima gravida may not have milk fully come in until 4th or 6th day. Breastfeeding, normal milk production, colostrum, early milk, full of important nutrients and antibodies. Mature milk comes in around 72 to 96 hours after birth. Can begin breastfeeding right after birth. Baby should eat for 30 minutes total, 15 minutes on each breast. Baby is getting enough if they're gaining weight and there's 6 to 8 wet diapers a day. Breastfeeding, managing engorgement, feed baby regularly, express milk or pump if you cannot feed baby. Managing nipple soreness, make sure the baby is latching correctly and well. Apply small amount of breast milk to nipple between feedings and apply creams for cracked or irritated nipples. Breastfeeding. Managing engorgement if not breastfeeding. Firm sports bra, no underwire, cold packs, avoid hot showers on breast tissue, cold cabbage leaves, and mild OTC analgesics. Bubble He, uterus. Involution. This is 6-week process. Site of placenta sealed off to prevent bleeding. Organ reduced to pregestational age. The fundus and uterus. So the fundal height is immediately after birth, halfway between umbilicus and symphysis pubis. First 24 hours after, the level is at the level of umbilicus. Each subsequent day, it decreases by 1 finger breadth or 1 centimeter. Days 9 through 10 is contracted into the pelvis. The fundus is not palpable. Fundal location should be midline. Fundal assessment should feel firm, like feeling a grapefruit. If it's boggy, floppy, or spongy, massage. It's not contracting enough. If it's displaced to the side and boggy, have the client empty their bladder, then massage the fundus. Bladder. You're going to gain 2 to 3 liters of excess fluid during pregnancy. Diaphoresis and diuresis begins almost immediately postpartum. Daily urinary output equals 1.5 to 3 liters per day from 2nd to 5th day. Patients should continue to drink plenty of fluids daily, especially if they're breastfeeding. Bowels. Digestion and absorption begin to activate soon after vaginal birth. They feel hungry and thirsty, so you can eat. Bowel sounds should be active. Stool passage may be slowed due to hormones, and bowel movements may be painful or difficult due to hemorrhoids, episiotomy, or tears. Hemorrhoids. During pregnancy, it's due to constipation and pressure from the baby. So what you do is eat fiber, stay hydrated, apply coconut oil, and don't strain on the toilet. For postpartum, it's due to the force of pushing and constipation. Eat fiber, sitz baths, cold compresses with witch hazel, and use a peri bottle. Lochia. Vaginal discharge similar to menstrual flow due to healing of the placental implantation site. Lochia rubra is red. This is blood tissue debris. The time frame is 1st to 3rd day. Lochia fuchsia is brown. It's more hemolysis, less blood, and leukocytes. It's from 3rd to 7th day. Lochia serosa, this is pink. It's leukocytes and cervical mucus. This is 7th to 14th day. Lochia alba is white. This is clear mucus secretion, 21st to 28th day. Lochia amount is assessed by saturation of perineal pads. Scant is considered less than 2.5 centimeters. Light is 2.5 to 10 centimeters. Moderate is more than 10. Heavy is the pad is saturated in 2 hours. And excessive blood loss is the pad is saturated in 15 minutes or less. The E in bubble heat, episiotomy and perineum. Perineum is edematous, tender immediately. Non-pharmacologic comfort measures is ice or warm packs, gentle pillow or donut pad, witch hazel. Pharmacologic measures is acetaminophen or ibuprofen. Homan sign is risk for thrombophlebitis. High levels of fibrinogen help protect against hemorrhage. Also puts at risk for thrombus. Assessment: redness, heat, swelling of calf. Homan sign. Position the knee in flex position and forcibly and abruptly dorsiflex client's ankle and observe for pain behind the knee. This is a positive Homan sign. Emotions promote bonding. Rooming in is an important step. Helps mom and baby bond. Increases success with breastfeeding. Overlooked or forgotten is normal, non-pathologic. Baby is center of attention. No one asks about parents' health or well-being and help reassure. And disillusionment is normal, non-pathologic. If baby does not meet expectations or imagines newborn, help reassure. Emotions, postpartum blues. It's normal, related to hormone changes. Signs and symptoms is irritability, mood liability, feelings of inadequacy, anorexia, sleep disturbance. Should resolve on their own. Postpartum depression. Major depressive episode with the onset of pregnancy within 4 weeks of delivery. Signs and symptoms present for greater than 2 weeks. Signs and symptoms are anxiety, sadness, anger and irritability, difficulty sleeping, intrusive thoughts. Screen women 2 to 6 months after childbirth. Signs of postpartum depression to look out for is excessive crying, sleep troubles, detachment from baby, brain fog, mood changes, and eating problems. Postpartum psychosis. It's a rare mental health emergency. Signs and symptoms is confusion and cognitive impairment, disorganized behavior, and hallucinations or delusions. Symptoms are hallucinations, delusions, confusion, suicidal thoughts, severe mood swings, paranoia, and insomnia. Discharge instructions for mom. Activity: Kegel exercises to regain pelvic floor muscle tone. Simple exercise can begin soon after birth, for example, walking. Limit stair climbing for the first few weeks. Post C-section is limit abdominal exercise for 4 to 6 weeks. Do not lift anything heavier than 10 pounds, not heavier than baby. Sexual activity and contraception can resume 2 to 4 weeks after, and recommend contraception. Can get pregnant again while breastfeeding. Okay, so clogged milk duct. Signs and symptoms is pain during letdown. This is the initial flow of milk. Pain or swelling near the lump, not your whole breast. The lump moves or gets smaller after you pump or feed, and discomfort subsides after you pump or feed. The interventions is lightly stroke breast towards the lymph nodes above clavicle to drain swelling. And then bait, breast rest, Advil, ice, and Tylenol. Breast rest is don't over massage or overfeed. Advil is 800 milligrams or ibuprofen every 8 hours for 48 hours. Ice is 10 minutes at a time while laying on your back. And tea is Tylenol, 1,000 milligrams of acetaminophen every 8 hours for 48 hours. Perineal tears. First degree may or may not need stitches, may sting while you urinate, and heals within several weeks. Second degree requires stitches, heals in 3 to 4 weeks. Third degree is repaired in the OR, heals in 4 to 6 weeks. It's risk for infection, dehiscence, and fecal incontinence. Do not use an enema. And same thing for a fourth degree. The care is use a peri bottle to wash yourself. Gently pat yourself dry with toilet paper instead of wiping. Apply ice packs. Avoid constipation. Sitz bath. Sit on a donut pillow and witch hazel. Postpartum hemorrhage risk factors: uterine atony, overdistended uterus, prolonged labor, oxytocin-induced labor, high parity, ruptured uterus, complications during pregnancy such as placenta previa and abrupto placentae, precipitous delivery, magnesium sulfate during labor, lacerations and hematomas, inversion of uterus, subinvolution of uterus, retained placental fragments, and coagulopathies. Postpartum hemorrhage. Priority intervention is massage the fundus. Other interventions is call for help, monitor vital signs, assess the bladder for distension. They may need a catheter, maintain and initiate IVF to replace volume loss, provide O2, 10 to 12 liters with a non-rebreather mask, elevate legs to 20 to 30 degree angle, and things to look out for if your patient is in shock: cool, clammy skin, confusion, pallor, tachypnea, tachycardia, weak, thready pulse, and diaphoresis. Infections: endometriitis, uterine infection. Signs and symptoms is pelvic pain, uterine tenderness, dark, profuse lochia, malodorous or purulent lochia, temperature greater than 100.4 or 38 degrees Celsius, and tachycardia. Mastitis, infection of breast, usually unilateral. Signs and symptoms is painful hard mass and reddened area. It's flu-like symptoms, axillary adenopathy in the affected sides. Medications: Carbapost, this is Hemabate. The classification is a uterine stimulant. The use is controls postpartum hemorrhage. Considerations is assess tone and vaginal bleeding. Adverse reactions is fever, hypertension, chills, headache, nausea, vomiting, and diarrhea. Magnesium sulfate. This is a tocolytic. It's a central nervous system depressant. It relaxes smooth muscle by suppressing contractions. You need to monitor for pulmonary edema, toxicity. This is the loss of deep tendon reflexes and decreased urine output. The antidote is calcium gluconate. The contraindications is vaginal bleeding, chorioamnitis, and acute fetal distress. Do not use with nifedipine and do not give if over 34 weeks gestation. Terbutaline. This is a beta-adrenergic agonist, a tocolytic. It relaxes smooth muscle by suppressing contractions. It stops preterm labor. You need to monitor for palpitations, tremors, tachycardia, hyperglycemia, hypokalemia, and hypotension. The contraindications is cardiac disease, diabetes, preeclampsia or eclampsia, hypothyroidism, and significant hemorrhage. Okay, so newborn assessment, APGAR scores. This is rapid assessment of extrauterine adaptation. 0 to 3 is severe distress, 4 to 6 is moderate difficulty, 7 to 10 is minimal or no difficulty. You complete it at 1 minute, 5 minutes, and every 5 minutes if needed. Acrocyanosis is a pink core and blue extremities, and you test grimace by smacking the heel. So A is appearance. A score 2 would be pink, score 1 is a blue extremities, and score 0 is all blue or pale. P is pulse. Score 2 is greater than 100 beats per minute. Score 1 is less than 100 beats per minute, and score 0 is no pulse. Grimace is score 2, cries and pulls away. Score 1 is grimace or weak cry, and score 0 is no response. Activity is score 2, active movement. Score 1, arm, legs are flexed, and score 0 is no movement. And R is respirations, where score 2 is a strong cry, score 1 is slow and irregular, and score 0 is no breathing. Molding is pressure from birth canal, where it molds the head into an oblong shape. It's common and harmless occurrence. The head will return to round shape within a few days. Sole creases are present in term infants. Term equals creases on 2/3 of foot. Post-term is deep creases on entire foot. Bowel movements. Meconium is a sticky, tar-like, blackish green. It should be passed in the first 24 hours. If it's not passed in 48 hours, you're concerned about ileus and perforated anus or volvulus. The transitional stool is on days 2 to 3, and it's loose and green. A normal stool is breastfed. It's going to be yellow and seedy, or formula fed, which is yellowish brown. Witch's milk is the term for milk produced by newborn babies, which can occur in both sexes. It is the result of large transfer of hormones from the mother right before birth, and it comes out their nipples. Newborn labs. White blood cells is 9,000 to 30,000. HGB is 14 to 24. Hematocrit is 44 to 64. Platelets is 150,000 to 300,000. Glucose is greater than 45. Bilirubin, the first 24 hours is 2 to 6. 48 hours is 6 to 7, and 3 to 5 days is 4 to 6. Preterm infant. This is born prior to 37 weeks, 7 days. Thin, shiny, pink and red, transparent skin. Little body fat, little scalp hair, soft lanugo body hair, weak cry and body tone, small underdeveloped genitalia, and they weigh less than 2,500 grams. Post-term or post-mature infant. Post-term is after 37 weeks, but before 42 weeks, 7 days. Post-mature is after 42 weeks, 7 days gestation. Dry, loose, peeling skin, overgrown nails, abundant scalp hair, visible significant creases on palms and soles, minimal fat deposits, meconium staining, long fingernails and toenails. Medications for babies, eyes and thighs. Erythromycin ointment. This is a prophylactic eye care. It prevents newborn eye infections from gonorrhea or chlamydia. This infection can cause blindness. Vitamin K injection prevents hemorrhage disorders. Newborns do not produce vitamin K in the GI tract until day 7. Administer into vastus lateralis. This is the thigh. Okay, umbilical cord care. Keep stump dry. Stick with sponge baths, not submersion baths. Let stump fall off on its own. You may see some blood near the stump. That's okay, and it's similar to a scab. Foreskin care. Newborn foreskin does not retract fully. Do not force it back. Treat gently. Wash penis with normal soap and water. No need for cotton swabs or special cleansers. It can take months to years before the foreskin can be retracted. At that time, gently pull back, clean, rinse, and return over the head of penis. Car seat education. Rear facing in the back seat. Car seat should have a 5-point harness. Shoulder straps must be at or below baby's shoulders. Harness should be snug. Straps should lie flat and straight line. Top of the chest clip should be at armpit level. Do not put blankets under baby. This will alter the fit of the harness. On a hot day, test the car seat with hands before putting the baby in. SIDS prevention. Alone. Do not share a bed with the baby. Baby should be in their own crib. Back to sleep. Sleep on their back. In crib. Bare crib, no toys, extra blankets, etc. Firm, flat mattress. Breastfeeding is recommended. Offer pacifier when sleeping. Newborn complications. Trisomy 21. This is caused by a third copy of the 21st gene. Characteristics upon birth is flattened nasal bridge, wide set eyes, low set ears, decreased tone. Expect the doctor to order chromosomal testing to confirm. Hip dysplasia. Signs and symptoms. One leg seems longer than another. Thigh and gluteal folds are asymmetrical. One hip may appear less flexible than another. Ortolani sign is positive where it's a distinctive clunk. You can hear it and feel it. Barlow sign is positive when there's a distinctive clunk. You can hear and feel it. The Barlow test is where the doctor adducts and depresses the femur in an attempt to dislocate the hip joint. Ortolani test is the doctor evaluates and abducts the femur in an attempt to relocate the hip joint. Hyperbilirubemia and phototherapy. Treatment for hypobilirubemia is UV light triggers the liver to process bilirubin. Expose as much skin as possible to the lights. Baby should be naked. Lights are harmful to retina and genitalia. Keep a diaper on at all times and keep mask on at all times. Eye mask. Hydrocephalus. Signs and symptoms. Unusually large head. Thin, shiny scalp with easily visible veins. Bulging, tense fontanelles. Downward-looking eyes, increasing head circumference. Myelomeningocele is a sporn of spina bifida. Sac extends from spinal column, filled with CSF and neural tissue, covered with meninges. Early surgical repair is essential to prevent further deficits. Preoperative care is prone positioning at all times. Sterile, moist dressing over sac, no clothing to prevent injury to spine, and use an incubator or radiant warmer. Neonatal abstinence syndrome. This is a group of conditions caused when a baby withdraws from drugs he's exposed to in utero, most commonly due to opioid use during pregnancy. The signs and symptoms are tremor, irritability, poor feeding, high-pitched cry, poor sleep, increased muscle tone, tachypnea, nasal stiffness. Okay, so Erickson's stages of development. Okay, from infancy to birth to 18 months is trust versus mistrust. They need responsive, long-loving caregivers. Toddlers is 2 to 3 years. This is autonomy versus shame and doubt. They need to make choices, gain control, perform basic tasks, simple decisions like preferences. Preschool is 3 to 5 years. This is initiated versus guilt, and they need to explore the world, exert control through play. School is 6 to 11 years, and this is industry versus inferiority. This is pride. They need pride in accomplishments through social interactions. Teen is 12 to 18. This is identity versus role confusion. They need sense of self and peer support. Piaget's stages of development, sensory motor is 0 to 2. The characteristics is think and present, learn not, extension of parents. And the nursing considerations is teach to patient as you are doing, like task procedure. Pre-operational is 3 to 6. This is magical thinking and symbolic thought, and it's role play before procedures. Operation is 7 to 11. This is logical thought and rigid thinking, and the considerations is they can learn tasks through demonstration and return demonstration. And then formal operational is 12 to 15 years. This is cause and effect and abstract thoughts, and teach like an adult. Risk-taking behavior equals risk for noncompliance. Okay, so growth milestones in infancy. Weight, 6 months, they double their birth weight. 12 months is they triple their birth weight. Fontanelle closure, posterior is at 1 to 2 months. Anterior is at 12 to 18 months. Teen physical development. Their final height, females at 95% of final height at onset of menarche, and males is a steady height growth until 18 years. Sexual development. Important to assess sexual activity and provide guidance. Ask straightforward, are you sexually active questions. Ask in private away from parents. School age eye exams. The Snellen chart. It measures visual acuity. The cover test tests eye alignment, which is strabismus. You cover one eye, look for movement in the uncovered eye. Uncover the eye and look for movement in that eye. Developmental considerations. Review and be familiar with contents of pediatric growth and development. Otitis media, ear infection. Signs and symptoms, tugging and pulling at ear, fussy crying, trouble sleeping, fever, clumsiness, and problems with balance. Pediculus capitis, this is head lice. Signs and symptoms is tickling, feeling of something moving in the hair, itching, irritability, difficulty sleeping. Lice, eggs, or nits are stuck on hair shafts.